Hey guys, Dr. Childs here. Today we're going to be talking about the compound Berberine, which you can get in supplement form, and it's one of my most favorite supplements because it treats a variety of conditions that many patients like you are dealing with right now, including things like high cholesterol, high blood sugar, weight gain, and so on. So if you have any of these conditions and you're interested in using the power of plants to treat these problems, then you'll find this information very helpful. So what is berberine? Berberine is considered what is called a plant alkaloid, and it is extracted from the plant Coptis chinensis. A plant alkaloid just means the active ingredient inside of the plant that helps that plant grow and helps protect it. So what we're doing is we're taking that compound, we're concentrating it, we're putting it into capsule form, and then you are taking it by mouth. Some of the benefits we're going to be talking about may seem even unbelievable, so I want to spend a little bit of time talking about why berberine is so effective right now. Berberine works by activating something called AMP kinase, and this is the exact same thing that is increased when you exercise. I think one of the easiest ways to think about the benefits of berberine is to think about everything that happens when you exercise. Those are the benefits that you're going to obtain when you take berberine, at least to a smaller degree. Now, I'm not saying berberine is the equivalent to exercise. I'm not trying to say that. But what I'm saying is that it helps to wrap your head around the benefits. And if you've exercised before, then you know that exercise provides benefits to things like blood sugar, cholesterol, fat storage capacity, mitochondrial production, and inflammation. So many of the same benefits you get when you exercise can be seen when you take berberine, but just to a lesser degree. But let me be clear here. I'm not saying berberine replaces exercise. I'm not saying that at all. But I am saying that berberine enhances the effectiveness of exercise and diet to a significant degree. And that's really how I recommend using it. All right, so let's talk about some of the benefits here. I think one of the best use cases is for the treatment of insulin resistance and high blood sugar. This effect on insulin resistance and blood sugar is so powerful that one study showed that berberine was equivalent to metformin in terms of its efficacy on lowering hemoglobin A1c. This effect primarily occurs because berberine helps your body eliminate and move around blood sugar from the bloodstream into the cells where it needs to go, thereby increasing insulin sensitivity. I want to share this quote with you from one of the studies that I found while I was researching this topic. Quote, "These effects cause the fat and sugar in patients with metabolic disorders to change from accumulation to decomposition," end quote. In other words, this quote is saying that instead of gaining more fat, when you take berberine, it's going to help you burn that fat for energy. Other studies have shown that the use of berberine may help lower fasting blood glucose by up to 28% and may lower the need for insulin in patients who are taking it for type 2 diabetes. Number 2, we have weight loss, and I can't think of a better supplement to help you lose weight if you're using things like diet and exercise than berberine. The reason berberine works for weight loss is because it inhibits fat-storing genes. So in other words, it's turning off the genes that send messages to your body to store more fat. In addition to this, it also helps to increase heat production, oxygen consumption, and accelerates glucose and fat metabolism. I think the best way to think about this is that berberine is enhancing the effectiveness of all of the normal weight loss therapies that you would be doing, like diet and exercise. Number 3 is gut health. Berberine has been shown in many studies to help improve the overall health of the gut. Traditionally, it was used to treat gastrointestinal infections like bacterial-induced diarrhea, but nowadays we have a lot of other uses for it as well. Berberine exerts its beneficial effect on the gut by improving the barrier of the gut, which means it's helpful for treating leaky gut, and through its antibacterial effects, which means it's helpful for treating conditions like small intestinal bacterial overgrowth and small intestinal fungal overgrowth. The antibacterial properties of berberine are so strong that farmers are experimenting with using it in place of antibiotics in their feed. It also has been known and shown to increase short-chain fatty acid production like butyrate. And if you don't know, butyrate is like fuel cells for your colon. The more butyrate you have, the healthier your colon and the healthier your gut will be overall. Finally, it's also been shown to reduce local inflammation in the gut as well as inflammation in the entire body. Number 4, we have its benefit on cholesterol, and this is another big one. There are 2 ways that berberine has been shown to lower cholesterol. The first is through its action on genes found inside the liver. These genes help your liver shuttle around cholesterol correctly. And number 2, we also have seen in recent studies that it may decrease the expression of PCSK9. This is the new target of many cholesterol-lowering medications. But you're getting this decrease of expression naturally without the need for prescription medications that may cause side effects. Several studies have shown that the use of berberine can help lower LDL cholesterol, sometimes referred to as the bad cholesterol, although I don't really like that distinction, by up to 21 to 25%, depending on which one you're looking at. These same studies recommended the use of berberine in patients who can't tolerate statins or their side effects. If you're thinking about using berberine to potentially lower cholesterol, which I think is a great idea, you have two options. You can use it by itself without other medications, or you can use it in combination with other cholesterol lowering medications like statins if you want. My personal recommendation would be to do whatever you can though to get off those statins and just use berberine, or in a perfect world, just use diet to fix your high cholesterol problem. You really want to get off statins as quickly as possible due to their negative side effects. Number 5, we have metabolic disorders. And this is just a fancy way of cleaning up the rest of the list of symptoms that we haven't already touched on. So we know that berberine can potentially impact conditions like non-alcoholic fatty liver disease, type 2 diabetes, PCOS, high blood sugar, obesity, elevated triglycerides, and more. So if you've ever been told you have metabolic syndrome or a metabolic problem, berberine likely has some benefit to you. The last benefit on the list has to do with your cognition or your overall brain health. Some animal studies have shown that berberine is beneficial in treating mild cognitive impairment and may reduce the risk of drug-induced metabolic encephalopathy. This is just a fancy way of saying berberine can protect your brain tissue. Let's talk about dosing. If the information was exciting to you, which I hope that it was, you're probably wondering, how can I take this and how much should I take? Here's some helpful information on that front. If you want to use it for everyday general health, the dose would be 500 to 1,000 milligrams taken each and every day. You would split that up into 500 milligrams in the morning and 500 milligrams in the evening. And if you're only taking 500, just use that one dose in the morning. If, on the other hand, you are using it to treat conditions like weight loss, metabolic health, high cholesterol, insulin resistance, or high blood sugar, the dosing is a little bit different. In that case, you'd want to use a little bit of a higher dose, somewhere between 1,000 and 2,000 milligrams per day. So in this case, it would look like taking 1,000 milligrams twice per day. That's what that BID means. You would use half of it in the morning and half of it in the evening. If you do use berberine, make sure you're using it long enough. If you were paying attention to some of the benefits I discussed, you'll know that a lot of the benefits of berberine are mediated through its expression of genes. And it just takes a while for those genes to become expressed and their benefits to be made manifest inside of your body. So give it time. The minimum length of treatment of berberine should be 3 months, but I would recommend using it even longer, especially if you're experiencing these benefits. And because berberine works differently than many prescription medications like metformin or insulin or even statins, you can combine berberine with a lot of these medications. Again, in a perfect world, my recommendation would be to do whatever you can to get off of those medications and just use berberine, or ideally just use food if possible. But don't be afraid to add these two things together, because then you'll get an enhanced benefit. And this is because the mechanism of action is different between berberine and these other prescription medications. Berberine is not the only amazing botanical ingredient out there. Another one of my favorites is black seed oil, because it has tremendous benefits on other pathways and it can be used synergistically with berberine. If you're interested in learning more about black seed oil, I recommend checking out this video next.